STIs, or sexually transmitted infections, can most definitely be passed orally, including a very common one known as the common cold sore. And a few of the other ones that can easily spread between partners include herpes, which cannot be cured, only treated, HPV, which we now know contributes to cancers of the mouth and throat, chlamydia, gonorrhea, and syphilis. A few of these infections, like HPV, herpes, and chlamydia, are all very common, so it's very likely you're going to encounter them at some point in your life, especially if you dabble in oral activities without adequate protection. Oral sex is simply sexual activity involving a mouth and someone's genitals. It's as simple as that. And of course, there's all sorts of slang out there to describe oral sex. Some people call them blowjobs, head, fellatio, or cunnilingus. Say that 5 times fast. Cunnilingus. Cunnilingus. Anytime there's contact with another person's genitals, you are at risk of catching an infection. Syphilis and herpes are two that only require skin-to-skin contact. And of course, skin-to-mouth contact is also a way that you can catch these. The rest are often passed through things like blood, semen, and vaginal secretions. Barrier is the only effective way to minimize your risk of infection. Okay, barriers don't have to be quite that big, but they should cover the mouth. So let's look at some of the main barriers that are used for oral sex. For one, you can buy flavored external or male condoms, which provide a barrier between a mouth and a penis. Keep in mind that vaginas and other sensitive mucous membranes may not always dig the ingredients in flavored lube, so use cautiously. If you're offering oral sex to a vulva or an anus, an external or male condom isn't going to work. You're going to need something flat. So that's where the dental or oral dam comes in. You can either buy them pre-done, or you can make them yourself and impress your friends. So at some places, including sexual health centers, you can actually buy pre-made dams. However, if you don't have one handy, you can make one out of an external or male condom. So take your condom and open it carefully. This is not a task for people with jagged fingernails. If you have really long nails, you may want to go with one that's pre-bought, because of course your fingernails are going to get involved in this. So you unroll it just a little bit and you cut the top off. So your goal is to make a little tube that looks like that. All we're going to do is make one more snip. And now you have a latex barrier. All it has to do is be big enough to cover your mouth, and it helps to protect you. And of course, these are flavored, so that may help some folks as well. So there you go. You have your very own homemade dam. You can impress your friends at parties, or sort of pretend that you're a kinky Mr. Dress-Up. Does oral sex with a barrier sound like a drag? Just put some lube inside and outside the barrier, condom, or dam. Obviously, don't use enough that you'll lose your grip on the dam, but a little bit will help the sensations feel a little bit better to both partners. Some folks even use plastic wrap. If you don't have a condom or dam, plastic wrap is probably a bit better than nothing. The downside is that we really don't have a lot of research on it showing that it is as effective as latex at stopping viruses, which are really, really teeny tiny compared to bacteria. So we know for certain that latex condoms stop infections in their tracks. The stuff you wrap your sandwich in, well, it keeps your sandwich fresh, but we're really not quite sure on how it protects you from things like HIV. Have you just gone to the dentist? Remember, infections are often spread when they come into contact with little tiny tears in your sensitive tissues. And of course, if you've just been to the dentist, chances are you might have had a little extra flossing or work done, which may have increased the tears in your mouth, and thus your susceptibility to actually catching an infection. So hold off a day or two before trying oral sex, especially if you've just gotten braces. Be really careful too that you're not going to tear the barrier with your new braces. 1. Use a barrier like a condom or a dam. Add lube for decreased friction and increased pleasure. Be careful. If someone has an outbreak of an infection like herpes or is currently being treated for an STI and they haven't finished their treatment yet. Talk to your healthcare provider if you or your partner has one of these infections that you have for life. There are medications on the market that can cut down the likelihood of you passing and sharing that virus between each other. Finally, talk to your healthcare provider if you notice anything going on that doesn't feel or seem right to you. You may just have an infection that needs to be treated with a quick round of antibiotics. So remember, share the love, not the STIs. Sex can be a great way to add some variety to your sexual activities, and it's great for people who are worried about pregnancy or have just given childbirth or have had surgery in that area. So keep that in mind and stay safe and have fun.